Hello, everybody. This is another episode of Artificial Intelligence and Cybersurgery. We're here with my good friend, Professor Mohammed Abu Hilal, who's the chairman of surgery and professor at Brescia, the Poliambulanza in Brescia, Italy. I'm very happy it's always a pleasure to see him. I'll just let my co-host introduce himself, and we'll start the podcast.
Sure. Thanks, Andrew. Hi, Vincent Grasso. I'm head of social media and strategy for our journal. We are the only peer-reviewed surgical journal dedicated to all things AI, so it's exciting, and it's a great pleasure and privilege to have Dr. Hilal on the podcast this morning. Good afternoon, and thank you for your time.
Hi, good afternoon to you, Vincent, and good afternoon, Andrew. Thank you very much for the introduction and the invitation.
Yes, no, we're very honored to have the illustrious Abu Hilal here with us. So just for our viewers, I met Mohammed back when I was doing a pancreatic surgery fellowship with Claudio Bassi and Paolo Pedrezzoli. And at that time, Mo, remind me, you were in what year of your residency at that time?
I was in second year residency.
Wow, you were a little baby.
Yeah.
Also. Wow, that's amazing. And
it's been a long time ago, Andrew.
Oh, don't remind. You don't need to tell us. And then after you completed your time there, you actually went to the United Kingdom. Can you tell us a little bit about that, and a little bit about what type of surgery you do, because you and I we have the same passion.
Yeah, well, during my training period in Verona, I went to spend some time in the UK, in Southampton, and this time being prolonged it was supposed to be a year or 6 months or a year, then it was prolonged to become 18 years.
Wow.
Before I come back to Italy, yeah. And then I continued my training in general surgery, then in HPV surgery and minimally invasive surgery, and then became a consultant in HPV surgery in Southampton University Hospital in 2006, and I stayed there till 2019, end of 2019, when I came back to the Poliambulanza Hospital in Brescia.
So before we talk more about Brescia, I find this interesting because this is a little bit different from the United States. So you were in your second year, you went to Southampton, and now how many years during your residency were you able to do in the UK?
So I left, we met during my second year of residency, but
Right.
we stayed together for about a year and a half. I left
Exactly.
during my third year, the end of the third year.
Right.
So I spent 2 years of my residency in England. You could spend at these days between 6 months to a year, but in certain circumstances, if you ask for a special permission and if you are doing your thesis in the hospital where you are, and if the professor agree at that time, it was supposed that you can continue. So I've been lucky that I was wanted in Southampton, and that Claudio Bassi, Professor Bassi, was so kind to give me the possibility. So I continued there, got my specialty in Verona, then did for some years of formal training in England through something called FTA, fixed term training appointment. And then I did a fellowship in Leeds, and then I got my consultant job. I was very, very lucky because between the time I arrived to the UK and the time I became consultant, it took only 4 years. And and I became consultant there at the age of 35, which is very, very young to be a consultant in the UK, but I was lucky.
Especially as someone who didn't start residency in the UK, I would imagine.
Yeah, absolutely. So many of my registrars were much older than me, etc. But sometimes I've been lucky in life. Not many times, sometimes. And also, to be in the right place in the right time, and to have the right experience was very helpful.
And not that we want to talk about politics, but luckily this all occurred before Brexit also when
Oh yeah,
it was part of Europe, you know?
Yeah, long time before Brexit. Yeah, absolutely.
Yeah.
So yeah, it was much easier these days.
So you really, you really became a star of minimally invasive HPB surgery at your time at Southampton. We don't have time to go into the details of that, but talk to us now why you made the decision to go back to Italy and why you chose that hospital. I had the privilege of visiting there a few times, and it is perhaps the nicest hospital I've ever seen in my life. And I have been looking. I have seen many beautiful hospitals around the world, but it's really the operating room, the screens, the size of the flat screens you had, everything. It was amazing. So tell us a little bit about that decision.
So I'll tell you about two things. I'll tell you about me becoming a star in laparoscopic surgery and why. It's because I always loved laparoscopic surgery, and I'm sure many others has fallen in love with laparoscopic surgery. But I think I also been lucky to become the lead, the consultant, the in charge man when I was so young, and when I was in love with that thing. And when you are a lead and boss and young, you take a lot of advantage of your leadership position, and you can do things which are not obstacled by also your hesitation when you are old and very wise. So you are young, excited, no fear, no insight about fear, and then you can do. And the luck was that all this permit me to introduce to my practice in livers and pancreatic surgery, laparoscopic surgery, which wasn't introduced to that field. And when nobody else was thinking about it, or very, very few people were doing it. And that made you let me be one of the few and one of the
We lost we lost your voice for a second.
And about the second part, why coming back to Italy in 2019, I mean, I then, climbed in the ladder in the UK system, became a consultant, became an assistant professor, then an associate professor or reader. Then I became a professor in 2017. And at that stage, I realized that the trip of 1 year, 6 months became already 16 years without me noticing.
Right.
And I thought, well, there is a need for a change. So I started thinking about moving somewhere. And I started having some offers from different places, to be honest, very attractive offers. And but then the offer from Brescia came, and Brescia is the place where I studied.
Right.
I did my medical school, where I spent my youth, where I came from a third world country, unlucky country like Palestine, where there was nothing in terms of facilities or freedom, and came to a place where there was everything at the age of 18, and spent there like 8 years to 10 years. So all the memories and a lot of emotions were developed there and left there. And I always felt that I want to go to continue. There were chapters to close there, and emotionally. So when I had the offer from Brescia, I was attracted to it. And when I came to see the hospital, as you describe it, for any laparoscopic surgeon, it's
heaven on earth.
It's a marriage in heaven.
To
be there. And then when I met the leadership of the hospital and heard about the vision, which was surprising knowing a lot of the Italian way of thinking about how to develop things, that was something new, something very progressive to me. So I've been attracted by all this and decided to do this move, and actually gave up other offers which were very, very attractive, very, very more attractive from other aspects, to come to Brescia. And I think I'm happy to have done this choice.
You organized a wonderful guidelines meeting several months ago, and I had the chance to visit Brescia again. And we're not going to get into the reasons. We're not to get into how good they were to you back in the day. But I was very moved to hear hear that, and I couldn't agree with you more. You made such a wonderful decision, and a lot of people don't know about Brescia. It's really the regional powerhouse of Italy. I mean, it is they're known for being hard workers. It's you know, Einstein always said that the most cultured people he ever met were in northern Italy, and he's talking about that region between Milan and Brescia,
Lombardy.
really.
Yeah, Lombardy. I think it's the dynamo of the Italian economy, hard work, and thinking, and it's impressive actually. I mean, the way how things works here. If you come with some prejudice about how things work in Italy, I mean, here people are really very hard worker, wake up very early and work every day, to the point that between Brescia, Milan, and Bergamo, you can be a little bit nauseated from how people are attached to work and how they think about working. And while I used to consider myself a very, very hard worker, I feel myself normal, or sometimes I feel myself embarrassed when I see people working 7 days a week, not only 6.
Yeah, no, absolutely. I'm impressed. My father-in-law is from Milan, and you know, very, very, very hard worker. Also,
And also, you know, it's Brescia specifically. I think it's a very small city, to the measure of man, but full of all facilities. And although the city is not the biggest, but the hinterland is very big. So while the city is about 250,000 inhabitants, but the hinterland is about 1 million plus. And you have Lake Garda and Lake Iseo and Lake Idros, surrounded by a lot of beauties.
Yeah, no, it's a beautiful city, really, and the food is fantastic. As you know, you didn't mention the food, but I'm sure that's one of the reasons.
Oh, the food is fantastic. Yeah.
So you've been kind enough to be one of our associate editors in artificial intelligence, and you've been really pushing this next revolution in surgery. So Vincent, you're hearing about a chairman who is an innovator, who really was a pioneer of minimally invasive surgery. How do you envision bringing more artificial intelligence to a place like this hospital that we described, where money is really no problem? What are the type of things that you would like to see at Mohammed's hospital?
Yeah, I mean, it's so wonderful to hear, and I know, Andrew, you've seen hospitals all over the world. You don't speak about the best place you've ever seen too lightly. So that's fantastic. You know, I'm curious. I like all things, you know, you're in Brescia, you have a fantastic hospital, obviously well-trained people. Sounds like your hospital is busy, meaning, you know, the operating rooms are full, and you're at capacity. So there's always the challenge of, when you have a facility that's busy at capacity, what incentive is there to get busier, and how do you get busier, right? So if the operating rooms are full, you can't book more cases if you don't have operating time space available. You know, with telesurgery and teleconsultation and all the things that we talk and work on, that's a way for the hospital to extend its reach, its deliverable outside the confines of the physical Brescia. Is that part of your your thinking, how to expand the hospital maybe virtually?
So yeah, Vincent, thank you. So I have to say a few things, because it is very dangerous to describe any hospital that it has unlimited economic facility to spend, because even if you are the richest man on earth like Bill Gates, you will not really consider that you have unlimited money to spend, but you would spend money in a judicious way, and in a way which meets the vision for your company, for your institution, for your whatever is the type of business you are doing. And if we are in medicine and in hospitals, I think the most important thing that we spend the money for the best interest of our patients.
Sure.
So the best interest of our patients, or of patients in general, can include increasing the number of patients, and that's one thing. But I don't think this is the main thing. I think the main thing is improving the outcome of those patients who we treat. So I would prefer to treat 50 patients perfectly rather than treat 100 with hiccups and problems. And I think artificial intelligence not only can offer the possibility to reach out to more patients in terms of consultations, second opinions, and also attract for treatment, but also to improve the treatment of these patients that you are treating, because there are a lot of chapters of artificial intelligence that I'm sure Andrew can go through in details, where we improve the study of patients, we improve the diagnostic pathways of patients, we improve the diagnosis and the planning for treatments of patients, we improve what happens during the treatment of patients and the approaches in which we treat patients, how we follow them up, and how we improve their experience and the whole pathway. So I think artificial intelligence, with all its chapters or all its domains, can be applied in any hospital as in any other institution to improve the service that you are delivering. And I think my hospital has the vision that if it comes to create money to spend them for something which does make patients' experience better, they are willing to do, especially that it's a non-profit hospital. So the money that comes in have to be spent, and has to be spent for a better patient experience and better outcomes. So when we ask for robotic surgery, we have robotic surgery. When we ask for three-dimensional reconstruction, when we ask for liver segmentations, but not only in surgery, we do have very, very good, excellent departments and colleagues in endoscopy, where artificial intelligence is always so introduced through endoscopy for diagnosis of cancer and virtual colonoscopies and all this. We have also artificial intelligence in the robotic surgery, in the orthopedic department, and many others.
You know, we were just discussing how artificial intelligence is now being used to analyze mutations of tumor cells, to treat tumor cells that are grown in tissue cultures with different types of chemotherapy, and then to use computer vision to help choose which cancer treatment to use. And that's something that would be particularly exciting for pancreatic cancer and for the type of cancers that we deal with, which are really still some of the most vicious cancers. Do you have any plans of using AI specifically to, I mean, I know I should be asking perhaps an oncologist, but obviously you do a lot of cancer surgery. Do you know of any programs that you guys are starting or interested in?
So I think Andrew, this is very important. However, we have to say that this type of projects are projects where a collaborative approach with many other hospitals is needed, and this is to put together a huge number of patients and a huge number of tissue and genetic maps to be analyzed. And one hospital can't do it alone, but our hospital is very interested in collaboration. Me personally, as the chairman of the IMIPS International Minimally Invasive Pancreatic Surgical Consortium and the co-chairman of the EMIPS, which is the European Minimally Invasive Pancreatic Consortium, we run a number of studies, collaborative multi-center studies, including a number of trials at the moment. And we are starting something which is the ADAPTA study, which is where we study ampullary cancer, and specifically with this we collaborate with Professor Scarpa in Verona for the biomarkers and biological. And I think artificial intelligence and genetic mapping can be applied on these projects. So it is also much more of value applying this type of approach into randomized trials rather than on random retrospectively collected data. So we are open to some of these collaborations, and we can talk about it.
So actually, when I was in Verona, that's who I did my bench research with Aldo Scarpa, which you may remember.
So he's involved in that upcoming study about ampullary cancer. So I think we need to do something and introduce artificial intelligence to that project specifically.
So Vincent, can you tell Mohammed a little bit about artificial intelligence, how it can optimize nutrition preoperatively and postoperatively for HPV patients?
Sure, and I'm happy that you describe your hyper focus on quality. Andrew and I have spoken a lot about there's the three phases of surgery, quite frankly, is the pre-op, everything done before you walk in the operating room, what you do in the operating room, and then when you're out of the operating room, the post-operative experience.
Absolutely.
And the better we can enhance the nutritional status of a patient pre-operatively, and then once they're post-op, make sure that they're being followed correctly, we by definition get a better outcome. So we're working on things like utilizing conversational computing and body composition scales to make sure that there's a sync up between what people say they eat, what they actually eat, and what the body processes, right? So there's objective data, the conversational AI reaching out. Please make sure you missed this meal. You didn't do this. You didn't do that. Here's the data on the back end. And, that whole orchestration needs to be done by teams, and it's expensive. So hybrid human digital workforces provide that manpower, that resource. So this is super exciting, and your focus on quality is dead center, right? Best surgeon in the world has bad outcomes if when the patient goes home, the follow-up is bad, right? So, that's just what it is.
I am a great believer in what you say. So as I said before, we don't talk about patient outcome, but we should be talking about patient holistic experience. It's the whole bathroom. Sure. It's from the patient knock to your clinic till the patient go out of his follow-up in 5 years. It's a very long process. And I think specifically on nutrition, we should be working a little bit more because unfortunately, the majority of nutrition approaches, attention that is given to patient is based on the single center interest or single surgeon interest or approach or vision or experience or knowledge. And maybe with large studies and with large projects, we could arrive to a point where we have some data which consolidate into
Sure.
into a protocol which can be adopted worldwide, also to ensure that patients are treated equally in different centers and different places. And I think nutrition is an important aspect, especially in pancreatic cancer, where one of the most important problems is the undiagnosed malnutrition.
Yeah.
And because patients present late while they have a malabsorption component for a long time, and they just present when they are jaundiced. And with a very big operation and very complex operation, I think the nutritional status is essential from a surgical point of view with the healing, but also from a recovery point of view with all the neoplastic process. So
hey, Andrew, yeah, we're all in agreement about the importance of optimizing, the whole pre-op, post-op nutritional space. So we have to talk some more about that in another call.
Yes.
Yeah, I mean, one of the things I love about that region of Italy, it is amazing, but you have some of the best centers of pancreatic surgery in particular in the world located so next to each other, right? You have Verona, you have Brescia, you have Milan, even Trento has a nice experience. So the potential to do good research on artificial intelligence in the preoperative and postoperative space in particular is ideal because all the areas are next to each other, same language, same work mentality. So we're really going to have to talk with you again. Yeah. About this, because I really think your hospital would be ideal for this.
We will be very open to that. Yeah. I just wanted to say that you mentioned the meeting that we had in Brescia 4 months ago. And yeah, it's important to say that meeting was about putting guidelines on the future management of patients through minimally invasive pancreatic surgery, through robotic, laparoscopic, but it was specifically for this meeting, it was the first time when within surgical guidelines, we discussed the role and the impact of artificial intelligence in the future management of patients and in the future practice, surgical practice and surgical culture. And moreover, in the 10th of April 2023, we will be hosting a similar meeting on the liver, and where I hope that artificial intelligence would have even more space, because in the liver, there is more and more of artificial intelligence details and approaches and domains to be discussed and to be contribute to the future management of patients with liver problems.
And again, yeah, no, I look forward to that meeting. It was so well organized, and I know that the next year's meeting is going to be such a success. But as you mentioned, the liver has much more examples of artificial intelligence than pancreatic surgery. And I'm just going to take the time now to ask, are you going to have an element of transplant surgery also, or is it going to be non-transplant surgery?
No, the guidelines are just about resection, because the transplant surgery guidelines will be done, I think, in Asia in 2025. So, and transplant has a lot of different implications, and I think putting all together will make it that each part will lose value. So it's better to separate them. Yes,
because there's some nice artificial intelligence. They're using artificial intelligence and computer vision now to choose transplants, to choose. But as you alluded to earlier, the greatest advances, I would say, in computer vision are with liver surgery. As you know, a lot of the great work that's being done in Strasbourg and actually in other places in France in particular, and in Italy now, actually. I don't know if you work, there's a company that Isabella Frigerio works with. I don't know if you're in contact with them.
I had the chat with them, yeah.
Okay, great. Well, it is Sunday. We finally were able to make this happen. I can't thank you enough, both of you, for finding time for this podcast/webcast. I will let Vincent say some final words, and then obviously Mohammed, if you have any final words. So take it away, Vincent.
Sure, and thank you, Dr. Hilal, for your time on Sunday. We know you're busy, and we're excited to follow up with you on some of the other exciting projects we're working on, especially this nutrition one, and maybe talk on the next time about some of the work we're doing in video and AI. So that'll be fun. So any closing comments? Happy to hear from you.
Well, yeah, Mohammed, especially please mention the dates of your guideline meetings, if you remember them,
yeah,
and the month and the name, please.
Yeah, so no, thank you very much, Vincent, and thank you, Andrew. It's also Sunday for you, and I'm sure you, especially Vincent, I think it's too early for you, and you wake up specifically to run this webinar. So thank you very much for giving time to that on your Sunday morning. I'm sorry if there was a little bit of noise here, but with 5 kids at home, it's a bit difficult to find a silent corner. Yeah. So the meeting in Brescia will be on the 10th and 11th of April 2024. That's about the liver. We are holding another meeting on guidelines of how to manage the specimen when you resect a pancreatic head mass, and how to run the pathology exam. This will be on the 25th of March this year, so this month. And that's an important one, but for the liver, the big one, it's in 11th and 10th of April next year, 2024. So I look forward to see you and many other people who are interested in liver surgery, but also in artificial intelligence. And I'm sure Andrew and the team will do a lot of work on that meeting. Thank you.
Great. All right, guys.
Thank you. Hey, guys.
Buona domenica.
Enjoy.
Ciao a tutti. Ciao, ciao.
Ciao, ciao.
Ciao.